Hi, I'm Dr. Shelly Singh. I'm Senior Consultant Obstetrics and Gynecology at Rosewalk Hospital, New Delhi. See, that's a very interesting question which a lot of you ask us. Sometimes you will be really deprived of sleep also. Sometimes, there are tensions which are not allowing you to sleep as well. We always say that you should sleep more towards your left side, although of course it's not possible all the time to sleep on your left side, but it's always better that you lie on your left side because that sends more blood to the growing baby, because it does not compress the large vessels in your body. The other thing which is important is that make sure that you lie comfortably. Make sure sometimes, in the later time of pregnancy, it's very difficult to sleep. So make sure that you use a pillow. Sometimes you may require to use a pillow between your legs, close to your back, because it hurts a lot at that time as well. You are not able to sleep. So it's always good that at least some physical activity is carried out during the daytime so that, you're tired and you're able to sleep. Another important thing is that some exercise should be done, and make sure that you are sleeping at least for about 8 to 10 hours in the night and 2 hours in the afternoon if it's possible to sleep during the afternoon. That's the ideal recommendation, though in today's day and world when we are all running around it's not possible, but at least 8 hours in the night is definitely what is recommended. And we do not want you to be using any kind of sleep inducing medicines, no sedatives to be taken, because pregnancy is a time where you should be minimizing medicines as much as possible. So a lot of you ask us, should I take something to help me sleep? The answer is no. So in the first trimester, the very common symptoms will be that there will be a lot of fatigability. You will feel a lot of weakness. There can be nausea or a vomiting sensation. You can have nausea to particular food items as well. That means suddenly something that you really liked eating, you may just feel nauseous towards that as well. Or it could be nausea towards everything in general. You may not be able to eat at all because there may be a lot of vomiting that may happen. There can be a little breast discomfort as well, or a little breast heaviness may be there. Lower abdominal pain is also a very common symptom, and you may have the tendency of wanting to pass urine again and again. So these are the common symptoms which of course will be accompanied by missing your periods or not having your normal periods, which is called amenorrhea. So what happens is that most of you will ask us, how will I know when I have gone into labor? So it's very easy. First of all, how I tell you is that you will start having pain which comes from the back. It radiates to the front of the abdomen. So from the back to the front of the abdomen, it will be intermittent pain, which means that the pain will come and go. Initially it may come very, very infrequently, and later on the intensity and the duration of the pain will also increase. And along with that, you will have more frequent contractions. You may feel that the uterus or the abdomen has suddenly started becoming hard as well. So these are the labor pains as we call them. Sometimes of course these can be false labor pains also. So it's a good idea to go to the hospital, meet your doctor or meet whoever the resident doctor there is. Maximum they will confirm that it is, a false alarm. The other thing which is possible is that sometimes there can be intense passage of watery fluid which is called leaking, and this leaking is actually when the water bag bursts, so in layman's terms. So that is another thing which does tell us that you should now go to the hospital. The third thing is that along with this, sometimes there is a little bloody mucousy discharge which can happen, which is called the show. So these are the common symptoms which you would have when you are in labor, and it's a good idea to always talk to your doctor, inform them, and they will definitely ask you to come to hospital to confirm whether you are in labor or not. Oh yes, this is a very rampant question these days, and most of us, are actually battling this air pollution. So pregnancy is a time when the immunity goes down, and therefore, there are so many times when we have so many problems, respiratory illnesses and a lot of other issues which do come up. It's important that first of all, one must avoid going outdoors early mornings and late in the evenings when the air quality index is really very bad. Whenever you go out, also make sure that you have the mask which is available. These days we have a large number of masks which are available, but make sure it is the N95 which is used. The other thing which is important is that inside the house also air pollution is pretty bad. We think inside the house there is no pollution. It's not that way. It's a good idea to be using the air purifiers as well. And of course, most of us also do know about the plants which help to battle this air pollution. Some food items which can be eaten, which help to increase the immunity and which help to give us some protection, are good or jaggery. You can have vitamin C in the form of even amla and other things, or even a vitamin C capsule can also be taken. Along with this, we also need to increase the tulsi is a very good agent as well. Ginger is a very good agent, so even these things can be used. Dried ginger and all are also available these days, or otherwise you can have a little bit of green tea which you can have along with tulsi and ginger.